Hello dear students, myself Dr. Junaidul Amin. I welcome all of you to my YouTube channel. Today we are going to discuss about a topic that's multiple myeloma. Coming to the definition of the disease, it is a cancer that forms in a type of WBCs, that is, those WBCs are particularly known as plasma cells. Remember this thing, plasma cells. Coming to the clinical features part of the disease, we have to remember this clinical features by a mnemonic that goes like CRAB, C-R-A-B, CRAB. C refers to hypercalcemia. These patients will be having hypercalcemia. R refers to renal impairment. These patients will be having renal impairment in the form of light chain deposition in kidneys and hypercalcemia, as I already told you. Remember this, light chain deposition in kidneys and hypercalcemia. And A refers to anemia. These patients will be having HB or RBC count will be less than normal person. And the B refers to bone pathology. The bone pathology in multiple myeloma will present as osteolytic lesions that leads to pathological and vertebral compression fractures. That is about the clinical features part. Coming to the third segment, that's investigations of the disease. Investigations include serum or urine electrophoresis. When we do serum or urine electrophoresis, what we find is paraprotein spike, and that paraprotein spike is typically IgG. The second investigation we do in these patients is serum free light chain assay, and we find a characteristic thing of the disease that is known as Benz-John proteins. Benz-John proteins. Remember this. And the third investigation we do in these patients is bone marrow biopsy. By doing bone marrow biopsy in these patients, what we find is greater than 10% plasma cells in bone marrow. Greater than 10% plasma cells in bone marrow. Coming to the next segment of the disease, that is management part. The first thing is induction therapy with non-chemotherapeutic or chemotherapeutic regimens. Along with those non-chemotherapeutic and chemotherapeutic regimens, what we do is we do hematopoietic stem cell transplant. Hematopoietic stem cell transplant. And in those patients in which we fail to do, actually those who are not stable for hematopoietic stem cell transplant, what we do is we use three types of drugs. Those drugs include melphalan plus prednisolone plus thalidomide. Melphalan plus prednisolone plus thalidomide. Remember these three drugs. That's about the management part. Coming to the last part of the disease, that is complications. What are the complications of the disease? The first complication is pathological fracture. What do you mean by pathological fracture? Pathological fracture is a fracture that's break in the bones which is caused by underlying disease. That means secondary. Okay, the second complication of the disease is infection. These patients are at increased risk of developing infection. And the third complication is VT risk. The multiple myeloma patients are at increased risk of developing venous thromboembolism. How much risk is there? That's 20-fold risk than normal persons. Thank you for watching my video. Please do subscribe my channel. I'll catch you in the next video. Till then, take care. Goodbye.